Let's go over the warm-up. First question, what's the antidote for each of the following substances? For acetaminophen, the antidote is N-acetylcysteine. For salicylates like aspirin, the antidote is to give sodium bicarbonate to alkalinize the urine. Remember, aspirin is a weak acid, so to trap an acid in the urine, you're going to alkalinize the urine. For amphetamine overdose, you want to acidify the urine by giving ammonium chloride, since amphetamines are weak bases. For anticholinesterases and organophosphates, the first-line reversal agent is atropine, and then pralidoxime if the atropine doesn't work. Remember, pralidoxime regenerates acetylcholinesterase. And for the overdose of an antimuscarinic anticholinergic agent like atropine, the antidote is physostigmine, which is a cholinesterase inhibitor. So we treat atropine overdose with a cholinesterase inhibitor, and we treat cholinesterase inhibitor overdoses with atropine. Next, which testicular tumor is associated with each of the following statements? Histologically may have an alveolar or tubular appearance, sometimes with papillary convolutions. That's embryonal carcinoma. Composed of multiple tissue types is a teratoma. Histologic endodermal sinus structures called Schiller-Duval bodies is a yolk sac tumor. 25% have cytoplasmic rod-shaped crystalloids of Reinke is a Leydig cell tumor. Androgen-producing and associated with precocious puberty is Leydig cell tumors or possibly Sertoli cell tumor. The last question, what organism is commonly implicated in balanitis? Well, balanitis is infection and inflammation of the glans penis, and the most common causative organism is Candida albicans. Now let's get started with the lecture.
Hi, I'm Dr. Schuford, and welcome to our Step 1 video on bacterial toxins. So today we're talking about toxins. Toxins are poisonous substances produced by microorganisms. Now, we're going to talk about two different kinds of toxins, endotoxin and exotoxins. Let's start with endotoxin. Endotoxin is found within the outer membrane of gram-negative bacteria. If you remember back to the last micro lecture, we talked about how the gram-negative bacteria have lipopolysaccharide as part of their outer membrane. The lipid portion of their lipopolysaccharide, called lipid A, is the part responsible for the toxic effects of endotoxin. So the lipid A is trapped within the gram-negative bacterial structure while the cell remains intact. But once that bacterium is lysed, the lipid A is released into the host and causes systemic symptoms. Endotoxin-related symptoms can be severe, even ending in septic shock and death. Let's talk about how this happens. Endotoxin can activate macrophages, which in turn produce cytokines including interleukin-1, interleukin-6, and TNF-alpha. Interleukin-1 and interleukin-6 and TNF all mediate fever, but TNF can also cause cell death and cachexia. Now, another substance released from macrophages in response to endotoxin is nitric oxide. Nitric oxide causes vasodilatation, which can result in hypotension and development of septic shock. I think that this highlights an interesting aspect of human immune response, and that's the immune response itself is responsible for many of the severe symptoms associated with infection, including septic shock. Okay, so what else does endotoxin do? Well, endotoxin activates the complement pathway, increasing levels of C3a and C5a. C3a can mediate the release of histamine, leading to vasodilation again and increased vascular permeability and resulting in hypotension and edema. C5a, on the other hand, affects neutrophil chemotaxis. And finally, endotoxin activates tissue factor, which will in turn activate the coagulation cascade. And this is why we see disseminated intravascular coagulation, or DIC, with gram-negative sepsis. You'll hear more about this in the hematology section, but I'll explain it here briefly. DIC occurs when microthrombi develop throughout the body, consuming platelets and coagulation factors in the process. And this depletion of platelets and coagulation factors can then lead to bleeding issues. So you see clotting and bleeding simultaneously. Okay, so we just talked about endotoxin. Endotoxin is the lipopolysaccharide component of the gram-negative outer membrane. So it's part of the bacterial cell itself. Now let's talk about exotoxins. Exotoxins are proteins that are produced by the bacteria and then released from the bacteria. Now, thankfully, not all bacteria produce exotoxins. I say thankfully because these proteins are usually extremely harmful to humans, and very little exotoxin can go a long way. Usually the exotoxin-producing bacteria are gram-positives that have either plasmids or bacteriophages that encode for these exotoxin proteins. Another important point about exotoxins is that they are antigenic. You can develop antibodies to exotoxin. For example, tetanus and diphtheria vaccines are both toxoid vaccines, where the desired response is antibody to the toxin. Okay, so now that we've talked about exotoxins generally, let's talk about a few specific exotoxin-producing bacteria. This is probably a 4-star topic, so I really want you to concentrate here. Exotoxins come in several main types. Let me first mention neurotoxin, which is a toxin that interferes with neural transmission. Can you think of a couple toxins that would do this? The two that come to my mind are botulinum toxin and tetanus toxin. There are also enterotoxins. Enterotoxins affect the intestines, so these would include toxins produced by Shigella and Vibrio cholerae. I also want to mention the concept of superantigens. Superantigens are those exotoxins that are able to bind both an MHC2 receptor and a T cell receptor simultaneously. And this cross-linkage of the MHC2 receptor and a T cell receptor through one exotoxin allows for polyclonal expansion of T cells, causing a massive immune response and release of large amounts of cytokines. Remembering what we talked about just a few minutes ago regarding the host response to cytokine release, you can probably imagine how damaging an uncontrolled release of cytokines within the body can be. The two best known superantigen producers are Staphylococcus aureus and Streptococcus pyogenes, or group A strep. Go ahead and take a look at your study guide. What known toxins are secreted by Staph aureus and what's the action of each? So Staph aureus produces a variety of exotoxins. Let's talk about a few of them. There are 4 hemolysins: alpha, beta, gamma, and delta. Alpha hemolysin, also known as alpha toxin; beta hemolysin, also known as sphingomyelinase C; gamma hemolysin is a bicomponent protein that's both a leukocidin, that is, it's toxic to leukocytes, as well as a hemolysin, and that is that it lyses red blood cells. And delta hemolysin, also known as delta toxin, is toxic to erythrocytes as well as other cells. Another important toxin I want you to remember is Panton-Valentine leukocidin. It's responsible for a lot of the tissue destruction that we see with community-associated MRSA, or methicillin-resistant Staphylococcus aureus. It too is a bicomponent toxin like gamma hemolysin. Panton-Valentine leukocidin affects both neutrophils and macrophages. Okay, so now let's talk about 2 superantigens produced by Staph aureus, the enterotoxins and TSST1. The enterotoxins have the ability to cause gastroenteritis. The term enterotoxin literally means toxic to the enteric system, so it shouldn't surprise you that it's associated with vomiting and diarrhea. The initial enterotoxins identified were called enterotoxin A through E, but many others have now been identified and described. TSST, or toxic shock syndrome toxin 1, is the toxin associated with toxic shock syndrome. Toxic shock syndrome presents with high fever, low blood pressure, and a diffuse rash that looks like a sunburn. A common test question on toxic shock syndrome will include a young woman that's just been on her menstrual cycle and left a superabsorbent tampon in place for a long time, and who's now experiencing fever, hypotension, and rash. So if you see this clinical scenario, think Staph aureus and toxic shock syndrome toxin 1. And the last type of staph toxin that I will mention is exfoliative toxin, which causes scalded skin syndrome in newborns. The toxins act at the zona granulosa in the epidermis, which results in flaccid bullae. This can involve large amounts of skin, sometimes almost the entire epidermis. This is usually seen in babies in their first week of life. Okay, moving on to Streptococcus pyogenes, also known as group A streptococcus. Look at the next question in your study guide as we go through this. What are the toxins for strep pyogenes? Let's talk about several of them here. There's streptolysin O, which causes hemolysis on blood agar plates. Streptolysin O is oxygen labile. Remember O for oxygen labile. You might recognize the exotoxin streptolysin O because we use antibodies to streptolysin O to detect when a person has had an infection with group A strep. We can order ASO titers in order to check the serum levels of anti-streptolysin O antibodies. There's also streptolysin S. Streptolysin S is oxygen stable, so remember S for stable. There are also streptococcal pyrogenic exotoxins type A, B, and C. They are also known as erythrogenic toxins. These act as superantigens and are associated with a red rash and fever of scarlet fever. They've also been associated with streptococcal toxic shock syndrome, which is like the toxic shock syndrome that we just discussed with Staph aureus, but it's associated with a streptococcal infection rather than with Staphylococcus. Let's talk about some other bacteria that produce exotoxins. So Corynebacterium diphtheriae produces diphtheria toxin, which inactivates elongation factor 2, or EF2. Its effects include pharyngitis and this grayish pseudomembrane in the throat. Diphtheria toxin inhibits protein synthesis and is very potent. Cardiac and nerve cells are particularly vulnerable to damage from the toxin. The toxin can be lethal in very small quantities. Now for Pseudomonas aeruginosa. Pseudomonas aeruginosa is a particularly nasty bug. One of its virulence factors is exotoxin A. Exotoxin A also targets elongation factor just like diphtheria toxin does, thereby causing cell death. Now, I know that we cover Shigella in the gram-negative bacteria section, but let's talk about its toxin here. Shigella produces Shiga toxin. This toxin is very similar to the toxin that E. coli 0157H7 makes, which we'll be talking about momentarily. Both of these cleave host rRNA at the adenine base of the 60S ribosomal subunit, inhibiting protein synthesis and causing eventual cell death. Okay, now let's talk about E. coli. E. coli is found in huge numbers in the human intestinal tract. Most don't cause disease, but there are several different pathogenic types of E. coli that can cause human disease. I want to mention two toxin-forming types right now. One is called enterohemorrhagic E. coli, or EHEC E. coli. E. coli 0157H7 is one serotype of EHEC. Enterohemorrhagic E. coli forms a toxin called verocytotoxin, more commonly referred to as Shiga toxin. This toxin causes bloody diarrhea, and thus the name enterohemorrhagic E. coli. But it can also cause damage to renal and endothelial cells, resulting in hemolytic uremic syndrome that this organism is particularly known for. What is HUS? Do you remember the three major findings? For HUS, be sure to remember hemolytic anemia, thrombocytopenia, and acute renal failure. The other type of toxin-producing E. coli I want to discuss is enterotoxigenic E. coli, or ETEC. This type of E. coli can produce one of two toxins. The heat labile toxin stimulates adenylyl cyclase, causing an increase in cyclic AMP. The heat-stable toxin stimulates guanylyl cyclase, increasing cyclic GMP. Either way, you get watery diarrhea that's similar in character to cholera, actually. Enterotoxigenic E. coli is the leading cause of traveler's diarrhea, also known by a variety of titles such as Montezuma's Revenge, Delhi Belly, among others. All right, let's move on to Yersinia enterocolitica. This also produces a heat-stable toxin, which is very similar to the enterotoxigenic E. coli heat-stable toxin. Like E. coli's, Yersinia's exotoxin also activates guanylyl cyclase, increasing cyclic GMP. Yersinia infection can cause abdominal pain that's sometimes misdiagnosed as appendicitis, leading to the title pseudoappendicitis. Okay, Bacillus anthracis. Now, this is an organism that causes anthrax. Bacillus anthracis produces anthrax toxin with three components. These components are edema factor, lethal factor, and protective antigen. What I want you to remember is that edema factor is adenylyl cyclase, which increases cyclic AMP and causes edema. Now, Vibrio cholerae. It utilizes a similar mechanism through choleragen, or cholera toxin. Cholera toxin stimulates adenylyl cyclase, increasing cyclic AMP. This causes chloride and water to cross into the lumen of the intestines, creating large amounts of rice water stools that are typical of cholera. A person can lose 12 to 20 liters of fluid in a day, leading to circulatory collapse. And this is why rehydration is such an important part of therapy. It's really life-saving in many people. All right, now Bordetella pertussis. Bordetella pertussis causes pertussis and uses a different mechanism to accomplish a rise in cyclic AMP. Bordetella pertussis makes pertussis toxin, which binds to inhibitory G proteins and inactivates them. By blocking the activity of the inhibitor, there's an increase in cyclic AMP. Do you see a pattern here? Again, we're seeing this rise in cyclic AMP, and as you might expect, the structure of pertussis toxin is similar to the other bacterial toxins that we've talked about that also increase cyclic AMP. Okay, let's move on to Clostridium. Let's talk about a few toxigenic species. First, Clostridium tetani, which causes tetanus. The tetanus toxin responsible for the clinical manifestations of tetanus is tetanospasm. Tetanospasm blocks the release of the inhibitory neurotransmitters GABA and glycine. Without these inhibitors, motor neurons are firing unopposed and create persistent muscle contraction. This leads to lockjaw and other muscle spasm findings that are so characteristic of tetanus. Now for Clostridium botulinum, which is the etiologic agent of botulism. Clostridium botulinum actually produces several distinct exotoxins, currently labeled A through G. These all act at the neuromuscular junction and inhibit the release of acetylcholine. And when this happens, you get flaccid paralysis. This might show up on your test as a question about flaccid paralysis following consumption of spoiled canned goods. In these cases, the botulinum toxin is preformed in the canned food and the person ingests the toxin. You should also remember that children under 1 year of age should not eat honey because of the risk of botulism. In this case, the Clostridium botulinum spores are in the honey and they can germinate in the intestine of the infant, colonizing the colon and forming the toxin in vivo. Interestingly, botulinum toxin is now being used widely for therapeutic purposes, like to treat strabismus and blepharospasm, and it's also very commonly used for cosmetic purposes. So to quickly review, Clostridium tetanus releases the exotoxin tetanospasm that causes spastic paralysis by blocking release of inhibitory neurotransmitters GABA and glycine. Clostridium botulinum releases botulinum toxin that causes flaccid paralysis by blocking acetylcholine release at the neuromuscular junction. Now for one last Clostridium species, let's talk about Clostridium perfringens. Clostridium perfringens can produce alpha toxin, a phospholipase that causes gas gangrene and myonecrosis. Clostridium perfringens can also make an enterotoxin that's responsible for a large number of food poisoning cases. The enterotoxin is produced when food is left out too long after being cooked. The spores that can withstand that cooking process have a chance to germinate and produce the enterotoxin if it's left out for too long after cooking is complete. All right, just one more concept to cover before we end. Let's talk about the bacterial growth curve. I think this one will be pretty simple for you. Okay, look at this curve. Imagine that you have a pure culture of some bacteria and you inoculate a few of them into a liquid growth medium. Now, starting from the left, you initially have a little bit of a lag phase where the bacteria are adjusting and gearing up for cell division. Then the bacteria enter their log phase or exponential growth phase. And at this point, there are few bacteria with plenty of nutrients, so they're dividing like crazy. And interestingly, this is the phase in which they're very vulnerable to our interventions like antibiotics and radiation. Now, as the number of bacteria increase, the nutrients become depleted and the toxins begin to accumulate. And the bacteria just don't have the resources to divide quickly. So at this point, they slow their metabolism and their cell division. And this is the stationary phase. They're just kind of hanging out at this point. Some will form spores at this stage to protect themselves from an inhospitable environment. But eventually, the death rate does exceed the rate of division, leading to the death phase where you see the curve trend downwards. Okay, now let's move on to the end of session quiz. So go ahead and turn off your video, answer the end of session quiz questions, and then restart the video so that we can go through the answers together. All right, first question. What exotoxin matches the following characteristics? Inhibits acetylcholine release at the neuromuscular junction, resulting in flaccid paralysis. This is botulinum toxin. Phospholipase that causes gas gangrene. This is the alpha toxin of Clostridium perfringens. Inhibits the inhibitor of adenylyl cyclase, causing whooping cough. This is pertussis toxin. Stimulates adenylyl cyclase, resulting in chloride and water entering the intestinal lumen and causing diarrhea. This describes both the cholera toxin and the heat labile toxin produced by enterotoxigenic E. coli. Destroys leukocytes. This describes a leukocidin. Staph aureus has gamma-hemolysin and panton-valentine leukocidin, both of which are bicomponent toxins that are toxic to leukocytes. Composed of edema factor, lethal factor, and protective antigen. This is anthrax toxin that's formed by Bacillus anthracis. Enterotoxin causing rice water diarrhea. Again, this is cholera toxin, and again, that heat labile E. coli toxin. Remember the term rice water diarrhea for cholera. Causes scarlet fever. This is due to the pyrogenic toxins of Strep pyogenes. Causes toxic shock syndrome. The one I want you to remember is TSST1 that's produced by Staph aureus. Inactivates EF2, causing pseudomembranous pharyngitis. This is diphtheria toxin. Blocks the release of inhibitory neurotransmitter glycine. This describes tetanospasmin. That's the tetanus toxin. And next, list 7 bacteria that we just talked about that secrete enterotoxins. We mentioned Vibrio cholerae, and we mentioned enterotoxigenic E. coli, making that heat labile toxin that causes similar diarrhea to cholera. We also mentioned that Staph aureus has a series of enterotoxins. We mentioned Shigella, Yersinia, and certain Clostridium species, specifically Clostridium difficile and also Clostridium perfringens. And that's the end of our lecture on bacterial toxins. I'll see you again soon.
So I grabbed that old critter by the scruff of his neck and I said, "Mr. Squirrel, you are a rascal. You are a rascal." You know, that story always reminds me, I don't know why, but it always reminds me of the major toxins produced by Group A strep. You remember what they are? You've got your streptolysin S toxin, which is oxygen stable. You've got your streptolysin O, which is oxygen labile. And you've got your erythrogenic and pyogenic toxins that cause scarlet fever. But don't get that mixed up with acute rheumatic fever. That's a result of Group A strep infection too, but that's antibody mediated, not toxin mediated. And rheumatic fever occurs a couple of weeks after the infection. Would you look at the time? I get to talking and before you know it, time's up. Well, from all of us here, I'd like to wish you happy studying and God bless, my friend.